Hello, and welcome to the Take Control Initiative. We are pleased that you are joining the movement to talk about your future healthcare wishes early on. Our hope is that watching this video and participating in the prompted discussions will help you explore and understand your own feelings towards the kind of healthcare you want to receive in the future. It is also our goal to help you understand how to make sure that your future healthcare wishes are honored if you ever become unable to express your wishes yourself. While watching this video, you will be prompted to pause at key moments so that you can share your thoughts and feelings with the group. You can also feel free to pause the video at any time to ask each other questions or have an extra discussion. The more you talk about this, the better. Before we start, please take a moment to introduce yourselves and explain why you chose to participate in today's discussion. Pause video for introductions. Let's begin with some facts and figures. Most people would prefer to die at home, but unfortunately, most die in a facility. In addition, 90% of people say that talking to their loved ones about end-of-life care is important, but only 20% have actually done so. Likewise, 80% of people say that if seriously ill, they would want to talk to their doctor about end-of-life care, but only 7% report having had an end-of-life conversation with their doctor. Our silence or unwillingness to discuss this issue means that the future of our healthcare is in other people's hands. Up until now, you have lived almost your entire life with full control and dignity, and what we want you to learn today is that you can continue to do so by taking certain steps now. The following video, which originally aired on ABC, chronicles one family's experience with future healthcare planning. Following the video, share any thoughts or feelings that may have come up.
And finally tonight, ABC News wants to join you in something right at the heart of the American family. How we can all help the people who care about us make decisions near the end of our lives. And 9 out of 10 of you have told us that we should all be talking about it at all ages, what we want. And yet only a fraction of us have done it. And we know it makes a huge difference in the health of the caregiver as well as those cared for. So ABC News has taken cameras inside a vital, loving family, part of a new community, deciding to have the conversation.
This is 85-year-old Norb and his daughter Maureen.
My dad is 85 today. He's still very, very active. He's a wonderful friend.
Throughout life, daughter and father have always talked about everything, except one thing: how to control the end of your life in the same way you control the prime of your life. So dad and daughter gather the family together, 3 generations, for an act of love.
And so now we're just asking that you share some of your thoughts about what you would like at the end of your life, so that we can honor your wishes.
They are part of something new underway for families in America that says having the conversation is a gift parents and children give each other. And there's proof of the difference it makes. Studies show depression rates plummet after a loss if the families have had the conversation. Renowned physician Dr. Atul Gawande says doctors and nurses see it firsthand.
When you're there in that moment and you're talking to the family and you're saying, how much will it bother your father if he ends up this way? And they say, more often than not, I don't know. We never talked about it. That it is incredibly traumatic for the family, for the doctors involved. There's often conflict. It can tear families apart.
So Dr. Gawande has become part of a team led by Pulitzer Prize-winning writer Ellen Goodman. It is called the Conversation Project. It is a kind of guide for families looking for a way to begin.
If we give them a way to talk about it and give people something to hang on to when they're afraid to start this conversation, they can do it and pass it on.
Families like the Jennings. They looked over the conversation guide before they sat down together. First, there's laughter.
My golf swing's still good.
And then Dad directly eases his daughter's guilt and worry about having put their mother in hospice.
I felt like that meant we were giving up on Mom.
She was in a lot of pain, and I think I think it was handled real well.
And next, Maureen asks her dad for clarity on what he considers a good end to a great life.
So if you were in a condition where you couldn't make decisions for yourself, how extreme would you want us to take measures to save your life versus letting you go?
Well, I think I'm ready to go anytime. You know, I wouldn't prolong anything. I mean, I've lived a great life. Pretty lucky. And because of you guys, you know. And
unexpectedly, a grandson is inspired to speak up about his own wishes for his own life.
That if there was no meaningful communication, that I would want you to stop trying to intervene.
we aren't ready for you to go that soon.
Well, we're not ready for you to go that soon either, so.
And one by one, the others weigh in, all ages.
People don't do that.
Happy birthday, dear Grandma.
And with that, another family has joined a kind of estate planning for the heart.
Go!
The conversation beginning in America. So please tell us your stories in the days ahead about ways to begin the conversation with family members of all ages. Or if you don't want to have it, tell us about that too. My colleague and my friend, anchor Bill Ritter from WABC, and I will be reading your emails and looking at the great photos you're already sending us of your families. So go to abcnews.com, find the conversation and the guide, and we'll be seeing you right there.
We encourage all willing participants to now discuss the video that you just watched. To help guide your discussion, it might be helpful to consider the following questions. What did you dislike about the video? Who would you like to be present for your own conversation? Did any part of the video make you feel uncomfortable? Pause to share thoughts and feelings brought up by the video. Now we will take a moment to share 4 different perspectives about end-of-life wishes. You may identify with one of these statements more than others, or your wishes might represent a combination of these statements. There are no right or wrong answers, but we hope that these statements will help you better identify what you might want for your future health care. Follow along as I read the statements. I want mine to be at home, surrounded by loved ones, and full of dignity and compassion. I want mine to be on my own terms. I would like to plan it out as much as I can. I want mine to be put off as long as possible. I would like to have all care until the end. I want mine to be in a facility with great nurses providing comfort care. Pause to discuss the statements that you do or do not identify with. Now you will fill out a worksheet that will help you to explore your values, feelings, and goals around your future care. Please take a few moments to fill this out individually or with a family member. Pause to fill out the worksheet. While you were working through the values survey, you may have found that your responses to some scales were very obvious, while others were more difficult. Pause to discuss as a group the scales that were most difficult or easy for you. Oftentimes, the passing of a loved one can help us recognize the way we would like to spend our final days. Take some time to think about the passing of a loved one. Would you consider it a good death or a bad death? What made it good or bad? All willing participants can take this opportunity to share and discuss their personal experience. Pause to share an experience of a loved one's passing. Moving on, we are going to switch from the values-based portion of the discussion to one where we discuss the steps you can take to communicate and document your wishes for future health care. Medical directives are documents that allow you to spell out your wishes about the medical care that you would like to receive. There are 3 types of medical directives that we will discuss today: the healthcare proxy form, the do not resuscitate, do not intubate form, and the MOLST or POLST. The healthcare proxy form identifies your healthcare agent, often called a proxy, the person you trust to act on your behalf if you are unable to make healthcare decisions or communicate your wishes. This is probably the most important document for you to sign. When choosing a healthcare proxy, you should keep the following in mind. Your proxy should be someone who you trust to honor and respect your wishes, is comfortable carrying out difficult decisions, and who you feel comfortable sharing your health information with. Take a moment to think of a person who you could choose to be your healthcare proxy. Pause to discuss your choice with the group. The do not resuscitate, do not intubate form, also known as DNR, DNI, are medical orders signed by a physician that instruct healthcare providers not to attempt cardiopulmonary resuscitation, CPR, or intubation in the event of cardiac or respiratory arrest. CPR is a set of medical procedures that attempt to restart the heartbeat and breathing of a person who has no heartbeat and has stopped breathing. CPR can be life-saving in certain cases for otherwise healthy people, but is much less effective when a person is in poor health. Intubation and mechanical ventilation is the use of a tube and a machine to help get air into and out of your lungs. Unless a person has completed a DNR/DNI form, CPR and intubation will be attempted. People fill out DNR/DNI forms for a variety of reasons, but some common reasons include having a terminal illness or being in poor health. Strong and healthy people do not generally fill out this form. The MOLST, which stands for Medical Orders for Life-Sustaining Treatment, also called the POLST in some states, contains instructions from a clinician to other health professionals about what life-sustaining medical treatments like CPR, dialysis, and artificial nutrition to try or not to try on a patient. People of any age who have a serious advanced illness and want to express decisions about life-sustaining medical treatments can fill out a MOLST form with their doctors. It is important to remember that medical directives like the healthcare proxy, DNR/DNI, or MOLST form can be updated or changed at any time if you change your mind about your decisions. Pause to discuss your feelings about filling out medical directive forms like the healthcare proxy, DNR/DNI, or MOLST. The next part of the discussion will focus on palliative care and hospice, 2 related terms that you may have heard of. Palliative care is for people at any stage of a serious illness. It focuses on improving quality of life for patients and family members by relieving the symptoms and stresses of serious illness. It can include pain management and emotional support. Hospice is comfort care for people who have a life expectancy of 6 months or less. Hospice is not provided along with curative treatments like chemotherapy. Hospice can be provided in the home or in an extended care facility. Medicare, Medicaid, and most private insurance plans cover hospice service. Has anyone had an experience with hospice that they would like to share? Does this information change how you think about hospice and palliative care? Pause to discuss these questions. This concludes the content of our discussion. Looking ahead, here are some things that you can do now to take control of your future health care. Communicate your wishes to your loved ones and your doctor. Fill out medical directive documents, especially the healthcare proxy form. Use the physician letter located on our website to begin future care planning with your doctor and ask any questions that you have about the process. Spread the word to your friends and networks about future care planning and consider running a group discussion of your own. Visit our website at carediscussions.org, where you can find the following resources: physician letter, healthcare proxy form, DNR/DNI form, MOLST form, and the group discussion video. Remember to follow us on Facebook and Twitter. Thank you for keeping the conversation going. Goodbye.